You've described your trip to Gaza back in January as the single worst experience in your 36 medical career. Can you tell us what you saw?
Yes, thank you for asking me. I've been going to Gaza for nearly 15 years, and I thought I would be I'd be prepared for what I was going to see when I went into Gaza on Boxing Day. But what I saw at Al-Aqsa Hospital was the single worst series of cases I've ever seen in my career as a doctor. Appalling clinical situations we found ourselves in, a great lack of resources, but most of all, the most appalling injuries, predominantly on children and women. And I spent most of the 2 weeks operating on severe explosive injuries to the chest and the abdomen, and the majority of the patients I operated on were women, and I saw some severely injured children as well. I spent some time in the emergency room at Al-Aqsa Hospital as well, and saw some very small children with terrible burns, multiple traumatic amputations, and no real room to deal with these tragic cases. The resources were very limited. On some days we had no morphine, no strong painkillers to give these patients, and I remember seeing one small child who had terrible burns to her face, so bad that you could see the bones of her face, and she clearly had no chance of survival and was going to die, but we had no pain relief to give her. So not only was she certainly going to die, but she couldn't die peacefully. She died